Hello and welcome to the second episode of our two-part conversation series taking a closer look at the arthritis condition Axial spondyloarthritis or axSpA. I'm Breon White, Chief Executive of Arthritis Ireland. axSpA is a painful chronic inflammatory disease that primarily affects the spine and sacroiliac joints. While much is understood about axSpA, it can sometimes be difficult to find accurate and reliable information. During these conversations, we will speak with medical consultants and specialists, providing you with some well-researched answers to common questions asked by those diagnosed with axSpA. I'm delighted to be joined today by Breon White, Clinical Specialist Physiotherapist at the Mater Hospital, Dublin. Breon has been involved with an axSpA programme in the Mater for over 15 years. And hi Breon, thank you so much for joining us.
Thank you for having me.
I might start by asking you, I suppose, a commonly asked question, what is the difference, if any, between physical activity and exercise?
Well, physical activity is proven to be good for all of us, for lots of health-related benefits. Exercise is a structured activity where you have planned and structured exercise to achieve a certain goal. For example, if you wanted to run a marathon, if you wanted to run a 10K, you would do exercises to help you achieve that goal. If you want to become more flexible, you might do certain exercises to achieve that goal of becoming more flexible. So physical activity has well-researched health benefits for us all, but an exercise regime and exercise is specific to achieve a certain aim.
Okay, thank you. And I mean, in general terms, what are the benefits of physical activity and exercise? And then, more specifically, what are those benefits for axSpA?
Well, exercise has been proven for lots of health benefits, from cardiovascular benefits, bone health benefits, weight, blood pressure, etc. as well. And I suppose it's important to realise that patients with ankylosing spondylitis will have lots of these as well. And so there's a big research study done in Ireland relatively recently, published in 2020, which identified about 700 patients in 12 different centres around Ireland. And identified many comorbidities as well as the axSpA diagnosis: obesity, raised blood pressure, osteoporosis, diabetes. And it's well accepted that exercise will, regular physical activity and exercise has been proven to improve those and to prevent some of those conditions, or to improve the management of those conditions. Specifically for ankylosing spondylitis, a couple of other studies from Trinity in 2014 and 16 have shown that patients with axSpA have a lower level of physical fitness compared to the non-axSpA patient population cohort. And specifically they had reduced cardiovascular function, reduced flexibility, reduced strength, poor bone health, and they were less physically active. And those specific studies, albeit smaller studies, have identified huge improvements for axSpA patients. Better cardiovascular health, better bone health, better muscle strength, better flexibility, improved chest expansion so you can breathe a bit easier. So exercise is probably one of the most efficient ways of managing the condition.
Okay, and I suppose just as a follow-on, is there a particular focus for exercise for people with axSpA?
It's a question I always get asked. It's the one I don't have an easy answer for. So what's generally recommended is that exercise program for someone with axSpA is a tailored program specific to that person. That might depend on their lifestyle, their comorbidities, if they have any other health issues, based on an assessment, an individual assessment, because not every patient with axSpA will present the same. Some have more axial problems. Some will have more problems with their upper spine, up with their lower spine. Some will also have coexisting problems with their other joints, such as their hips, perhaps their ankles and feet as well. So one size does not fit all. So I think if you're assessed correctly and appropriately, and your lifestyle and your general health status taken into account, a structured, tailored exercise program is the best one for you if you've got axSpA. This will be backed up with research done in Australia in 2016. They had an evidence-based consensus statement with lots of experts, and they didn't recommend one form exclusively of exercise. Traditionally, I think the focus was on lots of stretching, which frankly tend to be boring exercises for a lot of people, and therefore the adherence to them isn't great. But the general recommendation from that expert consensus stadium from Australia suggested that people do a combination of cardiovascular exercise, so you're walking, running, swimming, that type of activity, which people are much more likely to do. Some flexibility and stretching, some strengthening, so absolutely you can do resistance training, weight training if you so desire. Some balance training, and that might incorporate Pilates type of training or yoga type of training. Weight bearing exercise is very good for your generalized bone health as well. So they'll be the exercises that are recommended as well.
Okay, you've probably covered my next question, which is what exercise is best for axSpA. And what I'm hearing there is that there is no one form of exercise.
No, I think the research has evolved our knowledge of it, because traditionally, as I said, it was generally a stretching program. Yeah. But the research has identified that multi-type of exercise tends to be the most effective. So what I'd say to people is do the exercise that you enjoy. You're much more likely to do it. Do the exercise you enjoy a lot. Do some of the exercises you don't enjoy a little bit, but make sure you do them. Do the exercise regularly. So regular exercise and adherence to an exercise program, you're much more likely to have a better outcome. So regular exercise as opposed to running one marathon once a year and doing nothing else for the whole year. A regular form of exercise, you're doing a little bit regularly as you can, has been shown to be much more beneficial. And your exercise should be tailored, so you should really consult with a rheumatologist, the chartered physiotherapist, your GP, and come up with an exercise regime that fits your lifestyle and is suitable for your general health status.
Yeah. And in terms of when we're talking about types of exercise, are there any particular forms of exercise that should be avoided when it comes to axSpA?
Well, I'm always reluctant to ask someone to stop doing an activity they really enjoy. Yeah. So if you're a marathon runner, if you're an Ironman triathlete, there's absolutely no reason why you shouldn't do those. If you're a golfer, and I'll always highlight the elite athletes in the world who have been diagnosed with the condition axSpA. So there's inter-county hurlers. One fella's got 3 All-Stars and 8 All-Ireland medals in his pocket. There is elite level of cricketers, golfers. An ex-Premier League goalkeeper has been diagnosed with that. Captain of the Ryder Cup has been diagnosed with that. So these are activities that people are operating an exceptionally high level of physical activity and sport who've got the diagnosis. Some research would recommend you stay away from certain sports, such as high contact sports. So I would it's about a risk assessing. Okay, so some sports have a high level of risk. So traditionally people would say avoid high contact activities such as rugby with a high level of potential neck injuries in a rugby as opposed to a GA exercise sport. Stay away from certain martial arts such as judo. Certain martial arts wouldn't be recommended. But I have met people diagnosed with axSpA who've completed Ironman triathlons, the full distance, who've run marathons quicker than I could dream of running them and doing them. So, I really would encourage people to maintain the activities that they enjoy doing and just seek a little bit of guidance from your rheumatologist, your chartered physiotherapist about the specific activities.
Okay. And we know that, when a person is living with axSpA, flares can become part of the, if you like, the progression of the disease or the journey of the disease. Is it possible to continue exercising during a flare?
Absolutely. I think the main thing is to recognize that you're having a flare, and that's probably the biggest obstacle for people, and it takes a few years to actually properly understand what a flare is and how it manifests itself. So if you're feeling more fatigued than normal, if you're more pain than normal, you're suffering more night pain than normal, your early morning stiffness is more apparent than normal, then you may be having a flare, and you should seek advice if you haven't gotten advice already from your rheumatologist, your GP. But yes, you still can and you still should keep up with your exercise program, but you need to balance that with the appropriate amount of rest. If you're having a flare, you should consider reducing your exercise intensity, and increasing your level of rest and your recovery, but still do a little bit of exercise. The last thing you want to do is to avoid all activity when you're having a flare, but get it managed early. So you may need to discuss with your doctor regarding the appropriate medications to take and to keep active, albeit at a slightly lower level, and really listen to your body. And if the symptoms that I described earlier on, if they're getting worse, then you might be overdoing it.
Okay. And I suppose in terms of people starting to to maybe incorporate exercise into their lives if they haven't been active so far? You know, look, many people would be familiar with, you know, these targets of 10,000 steps a day or 30 minutes of exercise 5 times a week, you know, but for somebody who's not currently active at all, you know, how can they get started?
I think it's important to be realistic with your targets. You know, you're not going to run a marathon if you haven't run 100 yards, you know, so being realistic and picking an activity you think you'll enjoy doing, whether it's a full round of golf, or whether it's walking a 5 kilometre walk, and gradually progressing yourself slowly but surely to do this and making time. And you have to balance your lifestyle and your commitments with work, home, family, etc. to what activity you're looking to do. So what I'd say is, you know, be realistic with your goals. Set yourself a goal in a time frame. Make sure it's realistic. There's no point trying to train for a marathon when you know you can't get out and train a certain amount of times for a certain time period. And to gradually increase your activities. I always think the Couch to 5K program has very good principles behind it. You know, that's an 8-week or a 12-week program to go from being relatively sedentary to achieving a 5 kilometre either walk or a run. And it's got very good overall principles. So you should try and see where your baseline is from an activity point of view and try to increase it by up to 10% a week. All the research would show for various health issues that if you increase your activity by up to 10% a week, your body and your bones and your soft tissues are happy to adapt to that increased workload. So I said the Couch to 5K type of program would be a good program to do. The other thing about adherence is a big issue. So, you know, if the weather is awful and you say, I'm going to go out walking 7 nights a week, you know, in the middle of January, February, realistically, most of us won't do that. And we'll drop off from it after a while. So it's kind of setting yourself a realistic goal and, you know, taking the opportunities to exercise. It might be that on your commute to work, you might walk a little bit rather than taking the Lewis or taking the bus. It might be, you know, parking your car a bit further away and going for a walk to and from the shop, or, you know, walking to school with the kids as opposed to driving to school with the kids.
And tie it in with an activity or
achievable goals that's realistic. For me, like, I try to exercise on my commute to or from work, so it serves a purpose, it serves a function, it gets me from A to B, so that when I do get home and I have my family commitments, you know, I don't have to go back out again and do that, because that can be difficult at times.
Yeah. I mean, you've mentioned already the importance of exercise for axSpA. Any advice on how to stay motivated? Because obviously, once somebody is diagnosed with this condition, you know, you're in it for the longer haul, you know, so, and exercise is so much a feature of the management. So how can a person maybe stay motivated?
I think making yourself educated into the condition is probably the key thing. And if you look at the evidence and the research that's there and use the various resources to identify this, it consistently will say that being physically active and regularly exercising is something that will improve your overall experience of the lifelong condition. There's no cure for it. It's a management strategy. And I think once you identify that and accept that, I think it will help you plan how you're going to structure your lifestyle and your activity to get back to, or to get into doing exercise as well. Goal setting is important, again, being realistic. And, you know, so a goal set of, I want to achieve a certain event. It might be walking around the local park. It might be walking, climbing a mountain. It might be whatever activity you want to do, and give yourself a realistic goal and give yourself a realistic time frame. So I'll try to achieve this in a month, 2 months, 3 months, etc. as well, bearing in mind your work commitments and your lifestyle commitments as well. Sometimes stating a public goal is recommended. So if you say to your family and your friends, I'm going to walk a 5K walk and I'm going to do it on a certain day, then, you know, your family and friends may hold you to that. A lot of evidence will say that exercise is better, regular exercise is better than doing no exercise for axSpA. Structured exercise is better than random exercise. Also, exercise in a group setting can be more beneficial. So you can be motivated by your colleagues doing the exercise. The adherence exercise is better someone else is depending on you to go for that walk or run or swim or whatever you're choosing to do. So I think publicly stating I'm trying to achieve a certain goal, getting support of your family and friends, work colleagues, and then making time to try to achieve that goal is probably the best way of doing it.
Okay. And in terms of, I suppose one of the beliefs or maybe the myths around living with arthritis can sometimes be that exercise may cause more pain or make the condition worse. what do you say in response to that?
Again, the research has evolved in that. Like traditionally, people felt that if you had an arthritis, you'd never run, you should never do certain activities. But now there's some emerging research to say that marathon runners have better cartilage in their joints than non-marathon runners because their body has adapted over the years of doing that physical activity. And I'll always say to someone, well, if someone can run a marathon and someone who can complete an Ironman or can play elite sport who has the condition and they're managing very well with that, being sensible but managing very well, then I would be very hesitant to limit someone to you shouldn't run or you shouldn't cycle a bike, etc. as well. So I think it's important that you do the exercise that you enjoy. If you're always a runner, you're always a golfer, you should still aspire to do that and continue that as much as you can. Obviously modifying it if you're in the middle of a flare, but certainly I would be very hesitant to stop someone doing activities they like.
Yeah.
And I suppose it's, giving yourself the time and putting time in for that effort and, that commitment to your family and friends. For your adherence, it should be a bit easier to do. People understand why you're doing it and there's a reason why you're doing it.
And, in terms of how much a person can do, in terms of how much exercise, is there an answer to that question? Or, when might a person know if they've done too much?
Well, certainly, as I said, we try to increase your exercise intensity by, say, 10% in a week is probably at a maximum. I've done it myself where I've over-exercised, I've done too much activity, I've been sore as a consequence of that. I think everybody has. It is, it's important to listen to your body. If you find that you're getting more symptoms that are suggestive of flare, more night pain, more inflammation, excessive fatigue, then you might be overdoing it. I think it's important that you're guided by someone. So if you're guided by a chartered physiotherapist or your rheumatologist into your activity, and monitor your activity as well. And your activity should be tailored to you. So some people will find that they've got very stiff lower back and they might need to do some flexibility of their lower back. On the same side, some people mightn't be particularly stiff there, but they might be weak there. So they might need to do more strengthening exercises for their back as opposed to stretching exercises. So it's a very individual condition. It does affect people in lots of different ways. I've met patients who've been diagnosed with axSpA who can move a lot freer than I can move. And I'm not aware of, I've been diagnosed with axSpA. So, the symptoms, it's very much symptom driven and it's very much individual. So I think it's important that you get advice and then you follow that advice. And if things aren't going according to plan, you consider asking for more advice and modifying your activity.
Okay. And, what advice do you have for somebody, when they're balancing their pain, but they're also with their need to exercise?
I think you have to listen to your body. I think you have to be sensible about it, and pragmatic about it. It has to be fitted to your lifestyle. If you are continually hammering away, and your flare is lasting an excessively long time, and you've consulted with your GP or your rheumatologist, then maybe you're overdoing it. So I think it's very much trial and error, and you might find one period of your life you can do a massive amount of exercise and you seem to be managing fine, and it's frustrating when there's other times of your life where you do relatively little and you seem to be intolerant of the exercise. And that happens both axSpA patients and non-axSpA patients as well. So I think if you listen to your body and gradually respond to how your body is feeling and just tailor your exercise regime and your lifestyle to that. Okay. I think it's the main thing I'd recommend.
And I suppose lastly, what would your top piece of advice to anyone watching, who's having a tough time at the moment with their axSpA?
Well, I suppose lots of people have axSpA who are managing at a very high level. There's some people with axSpA who are really struggling. I always use the elite sports people as inspirations. So, someone plays Premier League football or plays inter-county hurling and have the diagnosis and are still able to achieve such a high level. But we're not all Olympic athletes. So I think it's important that you're sensible about your activity. Simple lifestyle factors that are good for your general health and well-being, whether you do or you don't have axSpA, is important. So again, don't smoke. If you smoke, your inflammation levels tend to be higher, you tend to suffer with more symptoms, and that's being researched. Being sensible about your diet and your weight. There's a higher level of obesity in patients with axSpA, possibly related to inactivity. So be sensible about your diet. There's no specific diet you should follow, a normal healthy diet. There's no research to say a certain diet is better than another diet. There is some anecdotal evidence from patients that prefer this diet or that diet. If you look at the research, there's no specific evidence from that. So be sensible about your diet from a weight management point of view. Take into account your lifestyle. You know, your lifestyle may allow you to walk to work, or may allow you to walk the kids to school, or may not. You know, you may not have time to do 25 hours of exercise a week like the Ironman athletes and the marathon runners might do. So you have to be realistic from that point of view.
Yeah.
You know, do the exercise you enjoy a lot. Do the exercise you don't enjoy a bit. And, you know, we all tend to do what we'll prefer doing, and we kind of neglect the ones that we probably should be doing. We know we should be doing, but we don't particularly enjoy. So do them a little bit. But do the exercise you enjoy a lot, and listen to your body and adapt your exercise regime and your lifestyle, you know, to how your symptoms are behaving.
Okay, and I think on that note we can finish things up. Thank you very much for joining us today, Breon White.
Thank you for having me.
And thank you very much for joining us today. For more information on axial spondyloarthritis, please log on to our website arthritisireland.ie. You can also get support via our online Facebook support group and by contacting our helpline on 0818 252 846. Thank you again for joining us, and we look forward to seeing you again soon.